So we have a patient who's come in and they have had a ear mold that has come off the tube. So we're going to be replacing the tube. The first thing I've done is taken a wipe and wiped the hearing aid and the ear mold and everything down when I got it from the patient. So I've taken the ear mold off. The tube is quite stiff, so I'm going to use the little nippers to clip it off here, being very careful not to damage the ear hook. And then I pull it off the hook. I'm going to set the hearing aid aside. I am going to give the ear mold a rinse and get it all cleaned out inside. So I've rinsed out the ear mold. I'm going to take the blower and I'm going to blow it out to make sure there's no moisture left in there, as well as the vent. This is a Synthaflex mold, so I'm going to be using Synthaflex cement on it, so it will stick better. I'm going to put the glue in the tubing hole, and I'm going to take the tube and thread it through. Wires. It's a tight fit there. I like to pull it a little bit farther through and then cut it off evenly, and then pull it back through just a little bit. Make sure it's all lined up. I'm going to wipe it again just to make sure that there's no Synthaflex glue on there. I'm going to take the patient's old tube that came out. I'm going to measure it, and I like to allow just a little bit extra because it shrank up a little bit and was hard. So I'm going to put it back on the hook and make sure it's oriented correctly. And then I always like to give a fresh battery. I'm going to inspect the rest of the hearing aid to make sure that the microphones are all clear. Grab a brush. Brush out the microphones. And then I always like to give it a listening check just to make sure it sounds okay. And it sounds good. So there we have the tube changed, and I'm going to give it an extra good wipe before giving it back to the patient. I'm going to let it sit here for a few minutes and make sure that the glue dries. And that's how I do a tube change.